Hi, I'm Dr. Peter Hartman. I'm going to be producing a series of educational videos on psychiatric topics for a general audience. I trained in family medicine and psychiatry with a special interest in the mind-body connection. I've been on the faculty of 3 different medical schools, and I would like to provide some interesting and educational material on psychiatric topics for the general public. This topic today will be on obsessive compulsive disorder, a rather common condition. It involves about 2% of the population. So if you live in a city with, say, 100,000 people, you could expect there to be around 2,000 people that have obsessive compulsive disorder, also known as OCD. Now, OCD consists of 2 primary symptoms, obsessions and compulsions, hence the name of the disorder. The first one, obsessions, are thoughts or images or pictures in the mind, and I'll explain that further in a moment. And the compulsions represent either a physical action or a mental act. And again, I'll explain that further in a moment. Now let's discuss obsessional thoughts. These are unpleasant, unwanted, intrusive thoughts, urges, or images or pictures that happen repeatedly. There are certain common themes that make them unpleasant and even seem completely out of character for the patient. These themes include violence, sex, religion, health, orderliness, where things have to be in a certain order, and if they're out of order, it's very anxiety-provoking. So an example of that might be having obsessional thoughts that a loved one will be in a serious auto accident and severely injured. In terms of images, you might see an image pop into your mind of you stabbing your next door neighbor. And this is horrifying because you're not violent. You like your neighbor, you're good friends, and wonder, why do I keep having this picture pop into my mind? So those would be examples of obsessional thoughts. Now, what about the compulsions, the behaviors? So the individual feels driven to repeat certain behaviors or mental acts over and over again. And I'll demonstrate some of the behaviors in a moment. And the purpose of these behaviors or mental acts are to reduce anxiety or to ward off a bad event they're worried about, such as an accident as described. Now, an example of a mental act would be a picture of you stabbing your neighbor, which we talked about. And the idea of warding off the accident would be by repeating some phrase over and over again, such as, let her angel watch over her today. Let her angel watch over her today. And if you say this a certain number of times, then it will help protect her against an accident. Now, the patients generally realize that this is just sort of magical thinking and it doesn't really work, but they can't seem to help themselves. So this is a classic example of the actions that may be taken as part of the compulsive behaviors. This is an individual washing their hands to excess. They have an uncommon fear of germs. And so whenever they touch a doorknob or any surface where they fear there may be germs, they have to, as quickly as possible, go in and wash their hands thoroughly, not just for 20 seconds, but for 20 minutes. And they do this throughout the day so that their hands develop red, raw, cracking skin, which ironically increases their risk of skin infections on their hands. But nonetheless, this is a compulsive behavior done to ward off their anxiety and fear of germs. Now, in order for these kinds of obsessional thoughts or compulsive behaviors to be considered to be a disorder rather than just something that's happening to the person but not bothering that much, it has to either cause significant distress, a lot of anxiety, worry, or upset. It has to take over an hour a day to go through these various thoughts and behaviors, and or it impairs their functioning. So an example of impaired functioning would be someone who has a morning ritual. They have to go through certain specific behavioral steps before they can leave the house to go to school or to work or go shopping or whatever. And these behaviors take over an hour to complete, and they must be done in a specific order. And if the person is concerned that they may have missed a step or that they did a step out of turn, they have to go back to the very beginning and start the process all over again. So a process that at best will take over an hour may take several hours. So you could imagine how this could interfere with schoolwork, or in case of someone who's working outside the home, showing up for work late by several hours may result in them being fired, or the student in school may not do as well or have to go in detention or what have you. So it clearly is interfering with their functioning. So that's what's meant by that. So let's say you have these obsessions and compulsions. What do you do about it? Well, there are 4 primary treatments, and I've listed them here pretty much in the order in which they are done. So the first one is psychotherapy, or the talking therapies. You can then add on medications. They don't take the place of the therapy. They're in addition to the therapy. And then if those two combined don't provide adequate relief, there's a newer treatment called transcranial magnetic stimulation. It's been approved by the FDA, and I'll describe that in greater detail in a moment. And then as a last resort, there are surgical treatments for OCD. So let's look at the therapy. This is the primary form of therapy, is called exposure and response prevention therapy. So what does that mean? It means that the patient, under the guidance of their therapist, will expose themselves on purpose to that which they fear. So taking the example of the person with the germ phobia who's washing their hands to excess, they will actually end up being able to touch a doorknob and not wash their hands right away. Instead, they will use anti-anxiety techniques that the therapist will have taught them. These are things like deep muscle relaxation and certain breathing methods. Now, if you do that frequently enough, eventually that urge, that compulsion to wash your hands will be extinguished, and you will not need to do that any longer. That's the whole idea. So the exposure is touching the doorknob, and the response prevention is not doing the hand washing, and instead using some kind of anti-anxiety technique that the therapist will provide. So this is an essential component of the treatment. It should be given to every patient with significant OCD. But if that is insufficient, which it may often be, you want to add in some medication. So what medications are there for OCD? Well, the primary one and the first choice are those types of medicines that are otherwise used to treat depression or generalized anxiety. And what they do is they raise the availability of a particular chemical in the brain called serotonin that's necessary for normal nerve functioning, where one nerve can communicate with the next one in a certain pathway. And this is what's used in OCD, as in the other things that it's used for treatment for. And it can be highly effective, but may not be perfectly effective, unfortunately. So examples of these medicines include like Prozac, Zoloft, Lexapro, or several others. What's different about using these medicines for OCD as opposed to depression or generalized anxiety is that you tend to use very high doses for OCD, roughly double what you would use for those other conditions. And that, of course, increases the risk of possible side effects. So it has to be done gradually so that your body can adapt. The other thing is that these medicines do not work quickly for OCD. If you're giving it for depression, you could expect some improvement in 2 or 3 weeks. Not so with OCD. It can take 10, 12, or even 16 weeks before you'll notice any improvement at all. So it's necessary for patients to understand this, that they have to be patient. They shouldn't give up the medicine too soon by saying, well, it doesn't help me. Well, yeah, it's only been 6 or 8 weeks, so I don't expect it to have helped you yet. So keep taking it. That's something the patient needs to understand. Now, sometimes the combination of the therapy plus this medication, when given at adequate doses for an adequate period of time, provide some relief, but not enough. What then? Well, you can add in a second medication that increases the effectiveness of the first medication and the therapy. And the medicines that we would use for this purpose are in a family called the antipsychotics. Now, I hate that name because OCD is not a psychotic illness, and yet we use it for that. But we also use it for depression and many other things. They're just called antipsychotics for historical reasons because they were first developed to treat schizophrenia, which is a psychotic illness. Now, an example of this medicine would be Zyprexa, the trade name, or olanzapine is the generic name. There are several others. And generally speaking, these medications are used in lower doses when treating OCD than when used to treat schizophrenia. And as an aside, this notion of using the same medicine for vastly different things is common throughout all of medicine. For example, good old aspirin. You can take standard doses of aspirin to treat a headache or a fever. You can use higher doses to treat certain forms of arthritis. And you can use very low doses like 81 milligrams a day to prevent a heart attack or a stroke. So same chemical, same medicine for vastly different purposes. We still would refer to it as a non-steroidal anti-inflammatory medicine, however. Now, what happens if you've gotten the therapy, you had one of the medications that raises serotonin availability in the brain, full doses for the proper amount of time, you've added in one of the antipsychotic agents, and the person is still suffering? Well, the next level would be providing this transcranial magnetic stimulation. Now, this is an FDA-approved treatment for OCD. It is more expensive than the medication, so generally an insurance company or Medicare will require proof that you've had an adequate trial of the medications and therapy first. It's referred to as a somatic or physical or biological therapy, or also referred to as neuromodulation, meaning it's sort of modifying the neuronal structure and function in the brain where it is applied. What it consists of is a coil with an electric discharge that's passed through it, and that creates a magnetic force. The coil is placed up against the skull in a particular place that's specific for OCD treatment, and the magnetic field is then applied and affects the neurons wherever that coil is placed. And it repolarizes them so they can kind of readjust their structure and function in that particular pathway. And this has shown to provide significant benefit for a lot of patients with obsessive compulsive disorder. Now, there are very few side effects. The only common one is a mild headache that can usually be treated with aspirin or Tylenol, what have you. There are some more serious ones that can rarely occur, but they are indeed quite rare. It does not require anesthesia, so the patient can drive themselves to their treatments and drive home or to work, wherever they need to go when the treatment is over. In current days, the treatment itself lasts about 1 to 6 minutes once the coil is placed properly. If the treatment center has an older machine and uses an older protocol, it could be as long as 20 or 40 minutes of treatment. But either way, once the treatment is over, the patient is free to leave. Now, how many treatments do you need? One treatment alone won't do much. You need a series of treatments, and typically this would be something like 5 days a week for up to 6 weeks. And then you're usually finished. So transcranial magnetic stimulation, or TMS, is an effective addition to our repertoire of treatments we have available for OCD. Now, what happens if you've done all of that and the person is still suffering significantly? Well, there are surgical options now available for these severe cases. The person is non-functional, they are distressed all of the time, they may be having suicidal thoughts, they may even have attempted suicide, and they're getting limited or no improvement with the prior methods. So then an option is to see a specially trained neurosurgeon who reduces the tissue in certain parts of the brain through a small hole drilled through the skull. It helps about half the patients. They notice meaningful improvement, and 15% or so may in fact be essentially cured. Unfortunately, there's a big risk involved, serious side effects that can include some cognitive problems or weakness or even paralysis of a part of the body. So this is not a treatment to be undertaken lightly. Clearly, it's invasive, it's expensive, and it's high risk. But for someone who's suffering sufficiently, it may be well worth it to them. Now, I'd like to conclude this discussion of OCD by talking about a very special type of OCD found in young children who have been infected with strep bacteria. They have a strep throat or scarlet fever, and then they develop this form of OCD. So what happens after they have the infection? Kids around the ages of 3 up to puberty will have the sudden onset of OCD after they have this infection. Now, they usually have additional symptoms as well. They can include some jerky body movements, some hyperactivity like they had ADHD. They may not sleep well. They may have some bedwetting even though they were dry until this happened. They may have some pain in their joints. Their mood may change. And they can have a decline in motor skills like their handwriting might deteriorate. So this is the result of the child's body producing antibodies against a portion of the streptococcal bacterium. And unfortunately, there's another overlap in the proteins involved with the proteins in normal tissue. And so the child's antibodies will attack their own normal tissue in their body, including their brain tissue. And that's the reason for the OCD and the hyperactivity and the mood changes and the like. Now, it has a very fancy name called pediatric, since this is in kids, autoimmune, meaning it's the body's own immune system involved, causing a neuropsychiatric disorder associated with streptococcal infections, and so that's called PANDAS. Now, the treatment for that is first to find out if the child still has the bacteria in their system by doing nasal and/or throat swabs, and if the bacteria is still present, then the doctor will provide antibiotics. If the condition is severe and not resolving with symptomatic treatment, there is intravenous immune modulating medications that can be provided that will also give benefit. And additionally, the doctor might prescribe other kinds of medications just to symptomatically treat some of the other symptoms. For example, the joint pain might be treated with an anti-inflammatory medication. So this is a very interesting and challenging disorder. The good news is that the majority of kids will show gradual improvement over time. Sometimes they don't need any treatment at all, they just wait it out. But it's an interesting condition. So that's a nice overview, I hope, of obsessive compulsive disorder, including that interesting sudden onset form that can be present in children. I hope you found it interesting and educational. If you have any other psychiatric topics you'd like me to present in future videos, please let me know. Again, thank you for watching and have a great rest of your day.